I take this privilege to introduce Dr. Hemlata Pandey, ma'am, who is a lecturer and program lead in forensic odontology at the University of Dundee, Scotland, UK. She provides expertise to the Crown Office and Procurator Fiscal Service, COPFS, which is Scotland's Public Prosecution Service and Death Investigation Authority. She also serves as an academic advisor to the Indian Board of Forensic Odontology. While in India, she established the first forensic odontology and human identification lab at a government hospital in India and provided expertise to state police departments and CBI as well. She has also been involved in disaster response and victim identification in India, and she is the president of Association of Forensic Odontology for Human Rights and also a TEDx speaker. I welcome you, ma'am, and we hand over the session to you now.
Thank you, Aarti. First of all, good afternoon, good morning, everyone, according to the time zone you are in. Amazing lecture. Thank you so much. So I'll just share my screen. Okay. Can you see the PPT, sir?
Yes, ma'am. Perfectly visible. You can make this as a full mode.
Okay. Right. So today I'm going to talk about child abuse, neglect, and forensic odontology. Let me start by just going over what are the topics I will be going on during the lecture. So I'll start with an introduction and I'll talk about the soft tissue and hard tissue injuries which could be observed in such cases and the causes for these types of injuries. I'll talk about bite marks with the point of view of child abuse, and from the same point of view of child abuse, I'm going to be talking about bullying, human trafficking, and negligence. I want to talk about forensic aspects of child protection and best practices in record keeping and the recommendations in the end. So let me first start by introduction, and I would go along with what Professor Emilio said. He quoted Professor Kemerier in saying that age is not, just a number. So the definition of child, it also varies depending on the situation or where it is being applied. So a child, we can say, is a human being who is between the stages of birth and puberty, or we can also say that between the developmental periods of infancy and puberty. The legal definition, however, would be someone who is a minor or known as a person who is younger than the age of majority in that country. So, for example, in India, the age of majority is 18, so someone less than 18 years old. And in many other countries, the age of majority is 18. So someone who is less than that would be a child. If you talk about treatment point of view or from a dentist point of view, we would say that pediatric dentistry is it deals with children who from birth through adolescence, or we could say like what the NHS says, from birth till their 16th birthday. So it depends on the situation of where we are looking at a child. But for us, for forensic purposes, and the legal definition of a child is someone who is less than the age of majority or less than 18 years old. Abuse. Let us talk about abuse. Now, the definition of abuse is it's an action that intentionally causes harm or injures another person. And there can be several forms of abuse. It could be physical or verbal maltreatment. It could be injury or assault, violation, rape, other unjust practices, crimes, or other types of aggressions. They're all abuse. And we will be talking about the different forms of child abuse in the next slide. We also talk about neglect or negligence in today's lecture. And the definition of neglect is, it is the willful failure of the parent or the guardian or someone who is caring for the child, the carer, that despite adequate access to care, to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. So when someone willfully fails to provide access to care, someone who is supposed to care for the child, it is called as neglect. And of course, I'm sure most of you who are attending this lecture today or this workshop today know what is forensic odontology. So I don't have to define forensic odontology for you. But forensic odontology it's the junction between the law and dental science, or the use of dental evidence in law. So for bringing justice. So forensic odontology is it's a junction between dentistry and the law. Let us now talk about the different forms of child abuse. So if you look at it, it's pretty simple when you say that there's physical abuse, there's emotional abuse, there's sexual abuse. But usually these are, it would be rare. I don't think it would ever happen that it is on its own, only physical abuse is happening or only emotional abuse is happening. These are usually these usually happen in a combination. So the same child will be suffering from emotional abuse or physical abuse or sexual abuse. So physical abuse is the most usual form. Any physical or mental injury or threatened injury on a child inflicted by a person responsible for the child's care other than by accidental means. Any physical or mental injury that cannot reasonably be explained by the history of injuries. Sexual abuse is when a child who is obviously under 18 years of age is the victim of criminal sexual conduct or threatened criminal sexual conduct by a parent, guardian, caregiver, or by anyone when a child is engaged in prostitution or is the subject of pornographic materials. Emotional abuse would be it frequently occurs as a form of physical abuse. So constantly yelling at, insulting, criticizing a child, or else excessive demands on child's performance, which result in a negative self-image on the part of the child or disturbed behavior. Here, I would also like to talk about a rare form of abuse, which is known as the factitious disorder imposed on another. And this was previously known as the Munchausen syndrome by proxy. It is when someone falsely claims that another person has physical or psychological signs or symptoms of illness or causes injury or disease in another person with the intention of deceiving others. So in child abuse, the caretaker of the child, which is very often the mother or the father, they may make up false symptoms, fake symptoms, or they may cause real symptoms to make it look like the child is sick. This is often attention-seeking behavior on part of the carer or parent. Now, as I said earlier, it is worth noting that these types of abuse are more typically found in combination than alone. So a physically abused child will also be emotionally abused, or a sexually abused child will also be physically or emotionally abused. So it is always a combination. Now, let us talk about injuries. Now, usually with infants and toddlers, we will see injuries which are inflicted by utensils or a bottle during force feeding, or with hands, fingers, scalding liquids, or caustic substances. I'm so sorry. I'm just trying to move this window with the participants' windows, and it's blocking my view. So I just keep on moving it. Okay. So these type of we can say weapons, or these type of instruments like spoons, forks, knives, while feeding, they may, or as listed above, the bottles, these may cause contusions, burns, or lacerations, and usually in the soft tissue, tongue, lips, buccal mucosa, palate, both soft and hard, gingiva or alveolar mucosa or frenum are affected. And with the hard tissue, it is usually the teeth which may get fractured or displaced or avulsed, or sometimes when the when there is too much pressure or too much force applied, we may even observe fractures. So usually we have seen that lips are the most common sites for inflicted injuries. All this data I have got from the articles which I have referenced on the right side. Lips are found to be the most commonly affected area, followed by oral mucosa, teeth, gingiva, and tongue. Frenal lacerations, if they are seen in pre-mobile infants, in infants who cannot move yet or who are not turning or crawling yet, we see if we see frenal lacerations, it is a cause of concern. Discolored teeth, again indicating pulpal necrosis, may result from previous trauma. Posterior pharyngeal injuries and retropharyngeal abscesses, these would be fabricated illnesses in a child to simulate hemoptysis. So for those participants who are not from the healthcare field, it is when you try to induce vomiting of blood to show that the child is sick. So this is a thing which you would see in the fabricated illness or Munchausen syndrome by proxy. So when the parent try to induce vomiting of blood in the child, it is an attention seeking behavior, and it is to show that the child is sick or the child is ill and they need attention. So in these kind of cases, the signs which we would usually see is posterior pharyngeal injuries and retropharyngeal abscesses. Gags applied to the mouth. So sometimes the child may be abused by applying gags to the mouth, and this may result in bruises or lichenification or scarring at the corners of the mouth. So when someone is forcefully gagged for a long period of time, or it has been going on for many years or many months, in those cases, we will see scarring at the corner of the mouth or bruising at the corner of the mouth. Now, injury or petechiae of the palate, especially when there is unexplained injury or petechiae of the palate, particularly at the junction of the soft palate and the hard palate, it may be a sign of forced oral sex. So in such cases, when the dentist suspects, when he sees such kind of injuries at the junction of the hard and soft palate, it is their duty to report it. Or if you are not sure in the beginning, you can consult a more experienced expert or a pediatrician, a pediatric surgeon, someone who has more experience in diagnosis of child abuse. You can consult them and ask for their opinion before reporting. But it is very important that these kind of injuries should not be ignored, and they should be reported to the child protection services or to the police, local police, immediately. So in such cases, a multidisciplinary child abuse evaluation will be preferred. So a lot of experts from different areas, including the forensic odontologist, the pediatrician, the pediatric surgeon, the forensic medicine expert, or the forensic pathologist, they will be a part of a team to evaluate these kind of cases. Now, if you look at hard tissue trauma or dental trauma, the most common is when a tooth is avulsed. So you can say the tooth comes out from the socket, it is knocked out. A tooth may be cracked or fractured, forced out of position. It could be luxation or lateral displacement or extrusion, or it is pushed into the jawbone. Okay, it could be intrusion, or it becomes loose. So it starts becoming mobile by impact. So these are the most common types of dental trauma. And just because you see dental trauma in a child, it doesn't mean that the child is being abused or he's a victim of abuse. There are so many reasons why a dental trauma may occur in a child. So it could be contact sports, motor vehicle accidents, fights, falls, eating hard foods, drinking hot liquids, anesthesia related. Sometimes it may be fabricated or self-inflicted, dental torture, or child abuse. So it is very common to see that in toddlers, the dental trauma will be caused by falling. So when they're learning to walk or their balance is not that great. It is very common to see them, they may fall and injure their teeth. Whereas if you see older children, it will be most probably because of sports. So while playing, these kind of injuries may be inflicted, which will cause fracture of teeth or displacement of teeth. So it has to be age appropriate, the injury. Okay, so if it's a toddler and there's dental trauma, and when you ask the history, if the parent says that they were playing a sport and something like this happened, then obviously it raises suspicion. So your history or the cause of injury should be age appropriate. So if, for example, as I said earlier, if it is a pre-mobile infant and a baby, an infant who is not moving yet, okay, so they are not even turning or crawling or anything, and if you see this kind of laceration or bruising, then definitely it raises suspicion. So we have to always be careful of the history which is being recorded. Now I would like to talk a little bit about bite marks. Now we all know bite marks. It could be acute bite marks which have been recently inflicted, or sometimes healed bite marks, or injuries which are in different stages of healing. So if there are several injuries on the body of a child, and all these injuries are in different stages of healing, which means that it is an ongoing chronic abuse which is going on for a very long time. It is very important that when a dentist, when they look at an injury and they feel that this may be a bite mark, or they suspect a bite mark, it is very important that such kind of injuries, maybe at a later stage, once the police gets involved or the investigation starts, it is very important that this be evaluated by trained forensic odontologists. Because as Professor Emilio mentioned even during his lecture about the Innocence Project, we have seen so many cases which are now coming up where innocent people were wrongly convicted. So it is very important that the guidelines which have been laid down by professional organizations, these should be followed when we are doing a bite mark analysis or trying to identify bite marks. So now bite marks, usually they appear as circular or oval shaped injuries, and sometimes they may have a central area of ecchymosis or central area of contusions. Usually these type of contusions could be caused by either it will be the positive pressure of the teeth, which will damage the blood capillaries in that area, or it could be by negative pressure of suction created by the tongue or the lips. Now, when we are doing bite mark analysis, obviously, if it's a recent case and it is acute bite mark, then it is very important that before you do any photography or impression taking, the area should be swabbed for DNA. So DNA is present in the oral epithelial cells, and whenever there is a bite mark, the DNA of the biter will be deposited there in saliva. So even if it's a dry injury, there is a technique called as a double swab technique. It's very simple. A sterile cotton swab is taken and it is made wet with distilled water, and the area is swabbed. After that, that swab is dried, air dried, and then it can be sealed and sent for analysis to the laboratory. And a second dry swab is taken, and second time the area is swabbed, and that swab is again dried and sealed and sent for analysis. So it's called the double swab technique. And usually if it's an acute bite mark, you will be able to find DNA of the biter in this swab, in this analysis. And of course that is followed by photography, and if you see indentations, you could do polyvinyl siloxane impressions of the injury. And however, before doing any kind of procedure such as photography or impression taking, it is very important that you always take consent of the carer or of the parent or of the guardian, whoever is responsible of the child at that time. we have to be careful. Sometimes injury, if there is a bite mark involved, it is also a case of sexual abuse. So in such cases, if the victim is providing a history of oral penile contact, in such cases the police may ask for evidence for those cases. So for forensic odontologists or for forensic experts or medical examiners, in when there is a history of oral penile contact, the buccal mucosa and the tongue, it can be swabbed with a sterile cotton tipped applicator. So this swab, again, it can be air dried and packaged appropriately for lab analysis. So it is very important that if there is a history, evidence should be collected accordingly. Now, this is an example of multiple pattern injuries at multiple locations in a toddler. So usually when it's a single injury and the parent is giving a believable history or a history which explains that type of injury without raising any suspicion, it's the dentist can believe the parent. But if there are multiple injuries, like in this case at different locations of the body, and you can see on the face, on the neck, on the arms, on the chin, all these areas would be easily accessible to the dentist when the child sits on the dental chair. So if these kind of injuries should raise suspicion, uh, especially you should ask the parent for the history, and you should see if the history given by the parent regarding the time, location, or the cause of these kind of injuries, whether it explains the injuries. But usually if these are multiple injuries, and especially you can see there is a pattern, in such cases you should immediately suspect that the child is being abused, and you should report it to the concerned authorities. Again, these are similar kind of injuries in an infant. So these kind of injuries, multiple bite marks at different locations, is very commonly seen in cases of child abuse, and it could be an infant, it could be a toddler, or it can be an older child or a teenager. Usually bite marks in infants or toddlers, it's not compulsory, but it's usually, these bite marks are punitive in nature. So they are inflicted as a form of punishment. The baby is crying too much, the baby has soiled their clothes, the baby is not feeding, kind of things, and the carer might get frustrated and they inflict bite marks. But in older children, in adolescents, in teenagers, these bite marks could be a sign of sexual abuse. The location of the location of punitive bite marks and the location of bite marks inflicted in sexual abuse would be different. And so all these things I'm saying are just, you can say, these are like a guiding principle. These are not something which would be like a rule. There is always exceptions. So it is always possible that a toddler is being sexually abused, or bite marks are being inflicted as a punishment in teenagers. So but this is like a general thing I'm saying, which is more commonly observed. Now I'd like to talk a little bit about bullying. When I was preparing for these lectures, I saw so many papers talking about bullying in children who have some kind of dental abnormality or orofacial abnormality, including malocclusion. So even if there is a slight malocclusion, these children could be victims of bullying by their peers or by their friends or by their groups. And this kind of bullying can lead to serious psychological consequences, including depression or suicidal ideation. So it is usually seen that children who reported physical abuse or who were victims of intimate partner violence, forced sex, and bullying were also found to have poor oral health. So it is very important that as dentists, we be involved with the community. We advocate anti-bullying programs in schools, and we talk to families and be involved in the not only the dental health of the patient, but also for their mental well-being. human trafficking has been discussed by Professor Nisolis already, but I would just like to go across, look at it from the point of view of abuse. So usually it is seen that the average age of children is around 12 years old, but there are case reports where a child as young as 4 or 5 year old has been reported to be trafficked. It is very common to see children who were in foster care, who were homeless, or who are runaways, or they are incarcerated in juvenile detention facilities. These are very commonly victims of trafficking. And usually there is a notion that human trafficking means international abduction, but that is not true. And geographical dislocation of a victim is not required to call it trafficking. There are different papers who talk about the dental and the overall health of victims of human trafficking, and I mentioned these papers on the left side. And what I observed from these papers was, in Europe, 58% of the victims of human trafficking, they reported tooth pain. In the US, more than half of women and children and adolescents reported dental problems, and the most common problem was tooth loss. Child trafficking victims have twice the risk for dental problems because they often suffer from inadequate nutrition, leading to retarded growth, poorly formed teeth, as well as dental caries, infections, and tooth loss. For older children, dental problems may trace back to their situations of origins with limited access to or poor quality of care. So even before they were trafficked, it's because they are their background, they don't have access or to good quality dental care, and that is where the foundation for poor dental health is laid down, or dental problems is laid down. Dental problems will also come from the trafficking situation in which the child is involved. So they will not have access to dental care when they were trafficked, or they will have so many unattended issues, or they will not have access to preventive care. And worse is that they, because of the torture or because of the physical or sexual abuse, they will have injuries, dental injuries inflicted on them, which are untreated. So these are the most important implications from our point of view as dentists. And I believe that all dentists should be more aware of how to deal with these kind of patients, and not just the dentist, but the entire dental team who work in a dental office. They should be trained, they should be given sensitivity training, they should know what are the legal implications, and how to deal with patients who were trafficked, and how to provide dental care to them, especially considering the conditions of abuse they have endured. Now, I'd like to talk about negligence a little bit. We already defined negligence in the first slide when we were beginning this session. It is a willful failure. Now, usually dental caries, periodontal diseases, and other oral conditions, these can lead to pain, infection, loss of function, and worse if they are left untreated. Now, these undesirable outcomes, they can adversely affect the learning, communication, nutrition in a child, and other activities which are important for the normal growth and development of a child. So usually we will see that a toddler who is coming in, or a child who is coming in with severe early childhood caries. Now, this is very commonly seen. When I worked as a dentist in India, I have seen this very commonly, even in India, that many children have severe early childhood caries. These used to be also called as nursing caries, or bottle caries and bottle caries. So this is very commonly seen. Now, when we are diagnosing neglect, so when we are looking at a patient and you are coming to a conclusion that this child is a victim of neglect, so when you're doing that, you have to think about a certain points. It's not very simple. Diagnosing a case of negligence can be very tricky. Now, first of all, you should be able to differentiate the different kind of carers. You should be able to tell that this child's dental health is being neglected. Is it because the carer has adequate knowledge and they know everything? They know that dental treatment will benefit the child, and yet they are failing to seek that dental treatment? Or is it because the carer doesn't have knowledge, they are not aware of the child's need, or they are not aware that the child needs dental care? So is it because the carer is willfully failing to give that kind of care, or is it because the carer doesn't realize, or they don't have knowledge, and they are not aware that the child needs dental health? So there is a difference between these two kind of carers. It is important that when the dentist is if the dentist decides to report a case of severe neglect, that he considers this situation. So it could be because the carer is not aware that this is a serious problem and he needs to get the child some dental care. Or sometimes it could be because the carer knows that the child needs help, the child needs treatment, but it's the family situation. Maybe the carer is not the decision maker and someone else is the decision maker in the family. Or it could be financial problems. They or the child is not insured, or they don't have good finances to get dental treatment. Sometimes it could be because of transportation. The dentist is too far and the carer cannot travel with the child for the purpose of dental treatment. Or sometimes it is not considered important to get dental treatment by the elder people in the house. So there can be different reasons why the dental health of the child is being neglected, and whether it should be reported or not reported. You should be able to consider whether there is a risk of harm to the patient, or there's immediate harm to the patient, to the child. You should be able to tell whether this dental treatment will greatly benefit the child's health. You should be able to see whether the child, whether their family have access to dental care, whether the dentist is close to them, whether they have the financial means of getting this kind of care. You should be able to judge whether the family or whether the carer is understanding the advice which you are giving as a dentist. And as I said earlier, you should know why the carer is failing to get the treatment. Is it because they are purposely ignoring? They know everything, they have means to get the treatment, but they are willfully ignoring it? Or is it because of some other reason they are not able to get the treatment, or they don't understand that they need the treatment? Also, you should consider what is the child's social, emotional, and medical ability, whether he will be able to get treatment without any special requirements. So all these should be considered when the case of negligence is being diagnosed. So it is very important that as dentist, you should consider factors such as family isolation, then a lack of finances, transportation difficulty, ignorance of the elderly people in the family, or lack of perceived value of oral health. Because sometimes the parents or the caregivers or the elderly people, they may feel that, oh, it's just deciduous dentition, or it's just milk teeth and their permanent teeth will come in and there's no need to treat milk teeth. So all these things should be taken into consideration. Now, before I start wrapping up, I would like to discuss the forensic aspects of child protection. So any situation where a child is being harmed as a result of abuse or neglect, it will potentially involve a criminal offense against the child. So different people have different roles to play in this kind of cases. As a dentist or as a forensic odontologist, it is not your job to investigate this crime. So the investigation of these kind of situations, it is whole and sole responsibility of the police, and it is usually done by the local police child protection team. The responsibility of the dentist is to cooperate with the police. responsibility of dentist is to provide comprehensive, contemporaneous and accurate record keeping for the whole process. Sometimes the dentist may also be asked to come in and give a statement if he was the one who has raised suspicion, or he was one of the people who agreed and was suspicious of the child being abused. So usually he will also be called provide statement or copies of the records. The police can even send a request that they need some kind of the radiographs or the photographs if the dentist recorded that during his examination. Now, responsibility of a forensic odontologist is when the police contacts them, they should be willing to conduct whatever forensic examination is necessary. They should be willing to analyze whatever evidence they have collected and to prepare and submit a report, and if need be, to go to court and testify. So it is very important that the forensic odontologist be formally trained and follow guidelines of professional organizations, and to avoid using newer techniques developed by themselves. So it is always important that you work in conjunction with your defense organization. So sometimes the dentist may feel scared, or they don't want to get involved in with the justice system. They don't want to go and get involved with the police, but it is very important that such kind of cases be reported to the police, so the dentist can even do this anonymously. However, if it was a child being abused and the dentist knew that the child is being abused and the dentist failed to report this case to the police, and this was known at a later stage, the dentist will be liable to punishment by fine or even by imprisonment. And there can also be an inquiry with the dental council in the country and all those legalities. So it is mandatory for the dentist as a healthcare provider to report such kind of cases when he is suspicious. Okay. It is also the responsibility of the dentist to maintain all kind of records. So best record keeping is very important from this point of view, that it will your records will form a very important part of evidence when the case is being heard. So you need to follow the best practices in record keeping. For the first and the most basic thing is to have all the personal information such as name, address, gender, date of birth, the school the child attends, the parent or the guardian's name, and if there's any relevant medical history like for allergies or if recent fractures and all those things. So these records should be updated whenever the child comes for the dental visit. So it has to always be updated. The second part is consent forms should be maintained. There should be detailed notes about examination, diagnosis, and treatment planning. And if there were any radiographs, photograph, or any other test done, all those records should be maintained. There should be a detail about what treatment was provided, and if possible to have the invoice as well. If any medicines were prescribed, and if there were any precautions, the leaflet handed over to the patient, or if further information was given about follow-up. Now, it is always important, that the dentist record who was the person who was accompanying the child. So that could be a parent or a close relative, such as a grandparent or guardian or carer. The dentist should also note down the child's behavior during the visit. So whether the child is shy, whether the child is happy and approachable, whether the child is withdrawn or whether the child is scared, all those things, if the dentist feels he sees something specific, it should be noted. And if there is any injuries, and a discussion with the parent about how that happened and the details surrounding that injury, it should be noted as well in the notes. Now, This is when you are suspicious already. So now if the dentist is suspicious that something may be going on and he can see injuries where he feels that the child may be being abused, then in those cases, he also needs to do these points. So he needs to observe any injuries. It is very important that history should be taken, and it is important to note what was the cause of injury given by the parent or the caregiver, when it happened, and how it was inflicted. You should observe if there are any different injuries at different stages of healing, some healed injuries, some scabs. All those things should be noted down. If possible, if you're good at drawing, then make a rough drawing or diagram of injuries. If the parent is giving consent, then take a photograph of the injuries. It is very important that when you are doing diagrams and drawings of the injuries, that you label it. What is the area? Give a short description. What is the injury, whether it is diffuse, whether you see some pattern, and you measure the injury. The dimensions of the injury. Okay, so the records should be complete with details, labels, dates, and times when you took these notes. The dentist should also see what were the appointment made and what were the appointment attended by the patient, whether the patient missed any appointments or they cancelled any appointments, and what were the dates of these missed appointments and cancelled appointments. When you're preparing notes as a dentist in such kind of cases, it is important that the dentist should note down what are the facts and what is his opinion. There should be a difference between these two. If there are some things which he feels from his point of view, if he feels certain things and there are certain, he has some opinion about certain things he has observed, he should make sure that he mentioned that these are the opinions and what are the facts. There should be a difference between the two, and it should be mentioned. Okay, so it should not look like the dentist opinion is a fact. Okay, so it should be clearly, there should be a difference between facts and opinion. It is important that the records should be stored securely. So there should confidentiality should be maintained, and no one should have access to the records who don't have permission. And they should make sure that the records are accessible when they are needed. So it should not happen that it's a hard copy, or it's a physical file, and which is lost now. We cannot find where it is. So it should not happen. The easiest way would be to maintain digital records. But if you're not able to maintain digital records at your clinics for some reason, then the best thing would be to have the physical file in a locked cabinet, and it should be numbered so that when you need it, or if you need it in the future, you can always access it and submit it to the police. So as I said earlier, diagram and drawing of the injury. This is from the British Dental Association. They have a pro forma for recording facial injuries. So this is something like this can also be designed for your clinic, and you can just roughly mark where the injury was, what was the size of the injury, and the location of the injury. There is a important mnemonic given by the American Academy of Pediatrics, which I mentioned on the right side. It's called as a 10-4. So if you see that there is a bruising on the torso, ear, and neck of a child who is less than 4 years old, then there is a definite cause to raise concern in that case. So you can raise suspicion, or you can be suspicious, and you have to be careful in cases where you see that there is bruising in a child less than 4 years old in the torso, ear, and neck region, because these are sites where accidental injuries are uncommon, and the injuries seen in these areas would usually be intentional and inflicted. So to sum up everything, the areas of concern would be if the parent is showing a delay in getting treatment. So if you see that there is a comparatively serious sign and symptom, comparatively serious injury, like maybe there is a big swelling, or there's bleeding, or there's a fracture, and the parent has not gone to the healthcare provider, to the doctor, to the pediatrician, or to the dentist, and it's been 5 days the parent has not gone. So in those cases it will raise suspicion, and these are areas of concern. You should also be careful when you talk about history. So sometimes when they are lying to cover up the injuries, they may change slight details every time you ask them the same thing. They may change slight details, or they may change the history when they feel that they are being caught. So you have to be very careful when you note down the history and you see that there is some discrepancy in their explanation. You should note down what is the child's behavior, whether the child is scared, whether the child is withdrawn, they don't want to speak. Sometimes some children like to talk, and it is very easy to, not very easy, but it is comparatively easier to ask them history and to note down whatever record they are giving. But most of the times we'll see in such cases the abused child is withdrawn, they're scared, they don't want to talk because they feel that they'll be punished later on for talking, or they sometimes also feel that the police will harm their abuser because they love their abuser. It is their caregiver, it is their parent or their guardian, and they love them, and they feel that the police will harm them, so they don't want to divulge, they don't want to tell all the information, so the child can be withdrawn. So the child's behavior should be noted down. It is important to see whether there are similar injuries in the siblings, especially twins. And it is very important to report such cases, because sometimes when one child is reported, other children in the household, they will then be examined, and they can be protected from the abuser, or the abuser is in contact with other children even outside the household. Those children can be protected. That is why it is very important to report, even if you see certain signs, you are just suspicious. So a dentist should not feel that I'm suspicious, I'm not sure, but and if I report, it will be a big police case and a big investigation, and I'm not even sure. They should not feel that. Because the police will not jump to conclusion just based on your finding. It only raises a red flag. So the police then can start the investigation and try to find out if something like that is happening. So it is the dentist should not feel burdened that because of me the family will be broken, or there will be legal problems within the family, or the child will have trouble. So you just raise a red flag, and it is the duty of the police, responsibility of the police, to investigate whether such a thing is going on. They will not solely depend on the dentist statement. They will look at other aspects. They will consult forensic experts, they will consult pediatricians, and all those things are done before any action is taken. The dentist should also see how the parent and the child is interacting in front of the dentist. So all these things should raise areas of these are areas of concern, and these should raise suspicion. Now, to wrap it up, there are certain recommendations for the dentist. One is you have to be alert. So when you're examining children, you have to be alert of the child's behavior, of any injuries you observe. Reporting is mandatory. So even if you're suspicious, it is important to report. It can be done anonymously in some countries. So you have to see what is the regulation in your country on how to report. Consultation with experts and experienced colleagues to assist in evaluation of difficult cases is very helpful. So if you're not sure, you should talk to your colleagues who are more experienced, or your seniors, or you can even approach your defense organizations like the association of which you're a member. You can talk to seniors from the association of those cases. Whenever there is a suspected bite mark, it is very important that a trained forensic odontologist examines and analyzes this kind of evidence. There should be community programs to bring about awareness regarding bullying. to help children who are being bullied or who are being neglected. It is very important to have community programs about dental health and neglect to bring awareness among families. It is very important that the dentists and their staff be trained about victims of human trafficking and how to deal with those kind of cases. Always update your educational resources you have in your clinic. And it is very important to provide sensitivity training to the staff and training regarding all the legalities of dealing with such cases. So these are my references, and I'd stop here. Thank you.